John.
Thanks a lot. It's a pleasure and honor to be here. So, and to be with all of you and all the great work you do. And thank you so much for having me. Today, I'm going to talk about accounting for the extra costs incurred by people with disabilities in the design of social policy. As everyone here probably is aware, if people with disabilities, they face extra costs of living. They have to, whether they're goods, whether they're services, and it can really affect how they live their lives. But most social policies don't account for that. And especially social protection policies. They're designed in a way that treats everybody with a disability the same and doesn't understand the support needs and doesn't understand how to address them. And some of the work that we've been doing at CIP is really trying to develop methodologies for estimating those costs, understanding the structure of those costs, and then saying, okay, how do we design social policies that are aligned with the actual costs that people face, so we can actually support their ability to participate fully. Oh, here we go. Oh, okay. So when we talk about costs, they fall into two categories. The first category are direct costs. So those are the actual expenditures made by people with disabilities. You take out money and you buy something, right? And then there's indirect costs, and those are foregone income, right? Because I wasn't able to get education, because there's barriers to employment, I can't earn as much money. Because I have a child with a disability and I need to support him or her, I don't go to work, right? And those are indirect costs, and they're different. And there are various barriers and facilitators in the environment that affect both types of costs. But they're not totally separate, right? Because direct costs can serve as a barrier to indirect costs, right? Because if I have certain barriers and I need certain amount of expenditures, a certain amount of resources to overcome those barriers, and I don't get them, it's going to affect my ability to participate, which is going to affect indirect costs. So the two things are very much related, but sometimes the policies to address one are different than the policies to address the other. And most of the time, the social protection policies are really focusing on the direct costs. We're trying to decrease these costs or subsidize those costs in a way that allows people to participate, which will then decrease the indirect costs they face, which is really the outcomes we're interested in, right? Income and consumption and things like that.
You might have to use the keyboard, Dan. Sorry.
Right.
The mouse.
Oh, there we go.
Sorry.
Got it. I should be good from now on. So when we talk about direct disability costs, they also fall into two categories. The first are disability specific expenditures, right? If I need a wheelchair, if I need a sign language interpreter, those are things basically that people with disabilities. But they also hire general expenditures, right? So people with disabilities might have to spend more on transportation. Can't use the public transportation. I have to take a taxi or buy a modified car. My costs of transportation are much higher. Medical costs. Everybody has medical costs, but people with disabilities might have higher medical costs that are related to their disability. But these costs, whether they're disability specific or the general expenditures, it's really important to keep in mind that these costs are a function of the current environment. So when we go ahead and we want to measure these direct costs, we have to realize that there's two ways of reducing those direct costs. One way is to provide goods and services to people with disabilities, right? Or to provide them cash benefits so they can go out on their own and get those goods and services. Another way to reduce those direct costs is to remove the barriers that are creating them. And therefore we can reduce the expenditures that are needed to participate by removing those barriers. And that's really important because when people first started looking at this and they found really high costs, it's kind of very scary to governments. Oh my God, it's cost that much required for equal participation. Okay, which is different. And one thing that we found that's really interesting actually is when we talk to people with disabilities lots of the time, we say, well, how much, what are the disability costs? How much do you spend? Lots of times they don't say very much, or they think of a few little things. But then when we start talking to them and sort of about their lives, they begin to realize how much extra expense, things like, for example, maybe they move to the capital city because it's the only place we can get rehabilitation service. They're paying more for rent. They don't think about that when you ask them how much are you spending extra because you have a disability. And there's lots of different things like that. But so one way, again, so we either ask them, what are you spending? Or we try to figure out, well, what would they need? Okay, but there's going to be a gap between those two things, right? For a lot of reasons. One reason is that families may not be able to afford the needed goods and services. Well, I know I need a wheelchair, but how can I possibly buy it? Right? I don't have the money. Or maybe they're not available. Right? My child really needs occupational therapy, but there's no occupational therapists in my country, let alone in my community, right? So I'm not spending what I need. It could be they're unaware of goods and services. They may not even know there's such a thing as occupational therapy, right? So they're not going out and spending money on something that they're not aware of. And unfortunately, there could be discrimination within the household, right? A parent might say, well, why should I spend money on this child in order to get her to go to school? She's in a graduate school, she's not going to get a job anyway, right? And so it's not worth my spending my time on this. So the math that's being spent is not what's needed. Okay. So we want to think, well, how can we go about measuring these things? What's being spent and what's needed? The first way that people looked at this was something called the standard of living method. And it uses a quantitative analysis based on household income and expenditure surveys. Okay? So if your household income and expenditure survey, which almost every country has, and almost every country does regularly, if it has a set of questions on it, like the Washington Group questions and child functioning module, that identifies people with disabilities, you already have all the data you need to use this method. And you know what you're doing, and you've used the data set, take you a week, I mean, literally a week, and you can have this estimate. But what is this estimate? The basic idea is, behind the SOL method, is that you take two families that are the same in every way. They have the same income, they have the same number of people in the household, they live in the same area, everything's the same. The only difference is one household has a person with a disability in it and one household doesn't, okay? And then you say, okay, what's the difference in the standard of living between these two households? Well, if they're the same in every way, except one has a disabled person in the household, that difference must be because they were spending money related to disability that they weren't able to spend on things that the other household could spend on. So for example, you have standard of living on y-axis and then income here. Or if somebody has no disability, in order to get this level of standard of living, they only need to spend I1. But if they have a disability, to get the same standard of living, they have to spend I2. So the difference between I1 and I2 is the cost. But remember, we're looking at households that have the same level of income. We're comparing the two of them. So what are we doing? We have to come up with a definition of standard of living, of well-being that we're going to use, okay? And we'll talk about more about that in a second, because there's different methods, okay? But first, what does the standard of living method tell you? And it's the most often used one. On average, how much more are households with disabled members spending to have the same level of well-being? So it's telling you the current economic impact of the direct costs of disability. So I can say, okay, a household without a disability, here's the poverty line. Okay, I have this, if I'm making over this amount, I'm not poor according to the government. But if that household has to spend a certain amount of extra money in order to achieve the same level of well-being as someone who's poor, then they are effectively poor, right? And when we look at the country, we can see that when we account for the extra cost of disability, the poverty rate of people with disabilities is much higher than it would be otherwise, depending on the country. And the advantage, as I said, of it is that it's inexpensive and easy to do if you have the household survey. And no matter what country you're in, you probably have that household survey. If it has questions on disability, then you can do it. But it doesn't tell you everything. First, it doesn't tell you what they're spending their money. Okay, oh, I'm spending $1,000 a month. Yeah, on what? Personal assistance, on medical care, on transportation, on, what am I spending the money on? So how do I, it's not like I'm gonna go out necessarily and give everybody the cash to cover everything. If you, you may not be able to do that. And again, how the amount and type of goods and services people are buying varies. Because most of these sample surveys, they're not going to be big enough where you could do it for people with physical disabilities, people who have hearing difficulties, people who have vision difficulties. They face different barriers, the supports they need are different, the costs they incur are different. And so it's you're just coming up with an average for everybody. And that's not very, it might be useful for trying to think about, oh, what's the economic impact of disability, but it's not very useful for thinking about how I'm going to design and deliver services or programs. And it doesn't tell you what people need to participate, right? As we said, there's a gap between what they're spending and what they need, and that standard of living method doesn't tell you anything about what they need. Okay, so while the information can be useful, it's very limited in what it's actually telling you. And we can see very different estimates from country to country for a variety of reasons. One is a different measure of well-being is used, right? Some studies have used a subjective measure. Do you feel like you're in financial trouble? Many studies have used something called an asset index, okay, where we look at the assets people have, running water, radio, a bicycle, whatever things they might have, and they create an index of well-being based on that assets. And the idea is, well, if I'm spending money on disability-related things, I don't have the money to build up these assets. So the difference in assets between households with and without disabilities, even though they have everything else the same, oh, that gap in assets must be because they didn't have the money to spend on it. So sometimes there might be differences from country based on those things. Also, what questions did you use to identify people with disabilities? If in one survey I'm using the Washington Group extended set of questions, and another survey I'm asking, do you have a disability? I'm identifying different groups of people, right? So I can't really compare country to country if I'm not identifying the same people. And finally, there's very different country contexts. And as a matter of fact, sometimes when we use the standard of living method, we see much bigger costs in rich countries than poor countries. Why? Think about the gaps. Why are there gaps, right? I'm in a rich country. Services are there. I can learn about them. I have the money to buy them. So I might be spending a lot of money. If I'm in a poor country and I'm trying to feed myself, right? And there's not much around, I might not be spending much at all. Okay. And matter of fact, we looked at this and in 8 African countries, we used the standard of living method and found very small estimated extra costs of disability. I shouldn't say extra, I should say extra expenditures. Extra expenditures on disabilities because they were in a situation where they didn't have it. So it wasn't having a very big economic impact on the households because they weren't spending money. That doesn't mean it wasn't having an impact on the household because poverty rates that people usually look at are just consumption-based poverty. If we look at multidimensional poverty, we say, oh, okay, the economic impact in terms of the economic resources in the family, maybe there wasn't a big impact, but those people weren't able to go to school, they weren't able to have friends, they weren't able, and so one paper we have that's just come out in a journal is saying, well, can we look at multidimensional measures of poverty as the measure of standard of living in these models? And unfortunately, there's a lot of problems in doing that. They're kind of technical. So if you're interested, you can look at this article by Monica Cancio. This came out. But basically, this is okay, let me go back. Hold on, I don't know how to go. so the conclusion of our article is, this is dangerous to use the standard of living method if you're thinking of designing social protection policy. Because the last thing I want to do is go into a poor country, do this estimate, find out that the extra cost of disability are 5% and think, oh, all I need to do is increase the social protection benefit by 5% and I've covered those costs. But I haven't. I've covered maybe what they're spending, but I'm nowhere near giving them what they need. Okay. Whereas when we do these studies in Norway and Sweden we see, really big extra spending. And there's a whole literature. So we decided, well, we need a different method. The second option on the table is something called the goods and services method, where we just go out and ask people, what are you spending? And here we can get the variance across disability types and degrees, because we can ask people with vision difficulties, what are you spending? We ask people who are neurodiverse, what things are you spending on? However, this requires a really expensive survey, right? Because I was talking about earlier about the extra cost of rent, right? I can go on and on. I mean, people with dexterity problems might have to buy pre-chopped vegetables. Okay, I mean, you can go on and think about it, talking to somebody and really exploring their life. So this is difficult, okay, in the sense that you have to have a really big survey, really designed to the country context. I'm not talking about buying chopped vegetables in some countries. In other countries, we are, right? And we still have this difficulty, the gap between what's being spent and what's needed to be spent. Okay, so goods and services method has a value to it, but there's some drawbacks to it. So the method we've been trying to develop is something called the goods and services required methodology. I'll talk very quickly. Basically, it relies on information from expert group of people with disabilities, parents of children with disabilities, professionals, and we have an expert group, and we have a series of focus groups. It's really kind of a qualitative methodology, actually, even though we're collecting numbers. And so by type and degree of disability and market research, because in some countries, for example, how do you put a price on things which don't exist, right? So there's a lot of just some technical issues on that, and there's stuff you can read about that. And then to say, okay, depending on the type of disability you have and the degree of disability you have, what are the things you need to participate? How much do they cost? But again, it's important. It's not saying, it's saying what's needed to be spent in the current environment, right? And again, one way of addressing these extra costs of participation is reducing barriers to change the environment. That's another way of reducing the costs, not just providing these goods and services that we identify. So with UNICEF, we did a study in the country of Georgia, looking specifically at the extra costs of children with disabilities. Okay, and so, for example, a child with physical disability, and so we looked at high support needs versus low support needs, and that was a big discussion. How do you, what's the difference? And with physical disabilities, and we see here are these are the goods, right? The goods that would typically be needed: a walker, orthoses, orthopedic shoe, transfer board, and development toys, car seat, a whole variety of things, and then an estimate of what that cost would be. Okay? And then we also looked at the support needs. Again, the assistive technology, personal human assistance, rehabilitation services. And I could talk more about. It's very interesting seeing the parents and the professionals negotiating over what they thought was needed. Okay, it had different ideas about it. And there's a lot of, based on the information from the focus groups and based on information from the expert groups talking together, they had to come to some sort of consensus. And what's important here is we're not getting an exact number, which is sometimes hard to explain to people. We're getting an idea of the structure and extent of these costs, which will become apparent when I show you this graph. But we also found when presenting, and there's a lot of numbers and a lot of tables, that sometimes it's hard to reach government people with that. Like, you're in a meeting, and what we decided in presenting this information, it was very important to have case studies to show how these things fit together. So here was one of the case studies used by Anna, a child with a significant intellectual disability, and there's a little story about who she is, and then what kind of support, what are the areas of support she might have. And we went through this, and then say, okay, for Anna, for this particular child, these are the things she needs. Can't really see up there, but how much does she need monthly? What kind of things does she have to spend on each month? Maybe what kind of things does she have to spend on each year? Is there any one-time purchases? Might be something might only need to make modifications to your house because they might only have to do it one time. and then add that all up. And then in Georgia, what they did was they said under the current system, how much of this would have to be covered by the family versus the government. So there were some things like anesthesia for dental care. It's not something I would have thought of, but the parents say, oh no, the only way I can get my kid to go to the dentist is if she's under anesthesia. That would be covered 100% by the government. But other things, communication cards, not covered by the government at all. So they also went to the government to say, here's what people need. This is what you're giving them. Okay, so, and what we see is a tremendous amount of difference depending on type and degree of disability. So this is just physical disability, high and low support needs. The yellow bar shows you the needed expenditures for children with low support needs, and the purple bar is high support needs. And you can see a massive difference, right? For physical disabilities, there's for low support needs, it's much lower. Okay, so one size fits all is just not going to be working. Okay, and not only is it much lower, but the breakdown by type of thing needed is very different, right? I mean, you can see the light blue is human support. It's a very big chunk of what's needed. It's smaller here, or purple. This one is actually clear to see. Mobility and accessibility. You got a big purple chunk up here, 806 gel. That's called in the currency. But down here you can see the purple's like very skinny, right? So again, these people need different things. Okay. And here it's a little overwhelming when you first see it, but this is monthly extra cost for children with disabilities by type and degree of disability. So it's, the first two are physical, high and low, support needs, then behavioral, high and low, complex medical needs, high and low, intellectual, visual, hearing, deaf, blind. They really wanted to separate that out because it's particularly high support needs. And you can see again, that the amount that's needed for participation varies widely, and the things people need vary widely. So in Georgia, the social protection program for children with disabilities was basically the same cash benefit for every child. And we said, look, if you're giving the same cash benefit for every child, it doesn't make any sense. Your program is not aligning to what's going on. And there's certain big chunks, like for example, the yellow is human support. If I had a personal assistance program or services that took the place of personal assistance and community support systems in the community so that people didn't need those personal assistance. If I took that yellow chunk out of each of those bars, they would all get much closer together, right? The variance between them. So one way of addressing it is saying, okay, what do we want to focus on? Personal assistance. Maybe all we can do right now is personal assistance and the same cash benefit for everybody. That would go a significant way towards structuring my program in a way that meets the structure of the costs. And then maybe transportation is big for some of them and not for others. And so you can start picking it apart. They did this study in Indonesia, and they came up with, oh, here are the 3 or 4 really cost areas. And so now, based on that study, they're actually decided to go ahead and pilot concession programs for the high cost items that they discovered in the research. So it's really exciting that they actually did research, found that this is where the big cost drivers are. So let's address those cost drivers direct. Okay, so instead of saying, oh, we're going to give you $1,000, we're going to say, oh, assistive technology is expensive. If you need assistive technology, we're going to cover that better than we did before. Because when you looked in Georgia, they were covering different people very differently in terms of how adequate it was. So the top of the bars is the total amount of goods and services required. The yellow part is the part that the government was already covering. So if you looked at government benefits and you value, what's the dollar value of those government benefits compared to the dollar value of what we think is needed for participation, you can see that for the people with vision difficulties, I think it's 40, if I remember right, it's 42% covered. Of course, what I should say is this is if the government program was working right. Some of the people said, oh yeah, theoretically that's what they should cover, but they're really not doing it. They're not reaching people, or they're having other problems. But that's a whole other issue. That's an implementation issue. in terms of the structure of the policy, if it was being implemented well, they'd be covering 42%. And even though the people with physical difficulties are actually getting a little bit more, because there's certain medical benefits that they were getting, it's way short of 42%, whatever it is. I forget what it is, 12%, 15%, something like that. So we say, and when we showed this to a group of organizations of people with disabilities, it was actually really helpful to them. Some of these people didn't realize how much cost the other people had. And they were advocating for higher benefits, and they were advocating for a percentage increase in the cash benefit. They said, these benefits are too low, we want to increase them 20%. And we said, okay, increase those yellow bars 20%. What are you actually accomplishing in terms of allowing children with disabilities to fully participate? You might be accomplishing something for these kids, getting a lot closer to them having what they need, but you're not. It's going to be a drop in the bucket for these kids over here. And then we say, okay, and then the government might say, oh, some of these costs are so high. Look how high that is. I say, yeah, but how many children are in that category, right? There might be a lot more children. These are high support. I should have said these are high support. That's one reason why these are so high. Okay, but there's a lot more children in the low support needs category than there are in the high support needs category, right? So maybe it's okay to say, hey, I'm going to cover these costs. They're big, but it's not for very many people. But if I try to cover them with a cash benefit, oh wow, I need to have a cash benefit big enough for these people. I'm going to be giving the low support people a lot more money than maybe they don't need. And so the whole idea is, how can we build our social protection programs in a way that they align with how the costs are incurred, so we can efficiently as well as effectively, because governments care about efficiency, and they should. They want to spend as little as they can, right? So let's have them do what we want them to do for the lowest amount of money possible, right? That's the only way it's going to get it done. So the final messages are, disability costs are large, but they vary significantly by type and degree of disability. So a one-size-fits-all approach to social protections not going to work. Goods and services required studies can reveal the structure of costs and help on the design of a suite or a set of programs to reduce them and to compensate. Like I said, it's also about reducing barriers. And social protection benefits must be designed to align with the structure and how those costs are incurred. And this is actually this is one of our big components of what Center for Inclusive Policy, CIP, is trying to do, I think. Thank you. That's the end. Thank you very much.
Thank you, Dan. That was incredibly enriching and very much to time.
Oh,
So lots of time for question and answers. I think one of the most powerful things which I found is, lots of